When it comes to nursing, what's the real difference between just good care and truly great care? Today, we're uncovering a hidden link, a really surprising connection that kind of reshapes the whole conversation. I mean, we all want the absolute best care when we're at our most vulnerable, don't we? So, what is the secret? Is it more training, fancier technology, or is the answer something way more human? Well, it turns out a really fascinating study uncovered an answer that you might not expect. It suggests the secret isn't some technical thing at all. Nope. It's a deeply human skill. And here's the kicker. It's one that a lot of new nurses, surprisingly, really struggle with. All right, so let's start there. Let's dive into what this crucial skill actually is. Okay, so this skill is called spiritual care competence. And I want to be super clear right from the get-go. This has nothing to do with religion. It's way, way broader than that. It's really about a nurse's ability to help a patient grapple with those big, scary questions that pop up when you're sick. Questions about meaning, about finding peace, about connection. In fact, the research goes so far as to call it the foundation of holistic nursing. But here's the thing, and it's a huge problem. So many nurses, especially the ones who are just starting their careers, feel totally unprepared to give this kind of support. The training just isn't there. And what's the result? Well, a really critical part of a patient's well-being, their spiritual needs, often just gets completely ignored. So, this problem led the researchers to their very first clue. They started to wonder, okay, maybe a nurse's ability to give this kind of care to someone else, maybe it's connected to something going on inside the nurse. And this is where the whole thing pivots. We're not looking at the patient anymore. We're looking at the nurse's own inner state. The study calls this their spiritual health. It's all about their personal sense of inner peace, harmony, and connection. You can kind of think of it like their own internal battery, right? It's the resource they've got to draw from before they can even begin to give that energy to somebody else. So to test this whole idea, the researchers zeroed in on a really specific group, 299 new nurses in China. And let's just paint a picture here so you know who we're talking about. These are young people. The average age is just 21. They're almost all women, fresh out of junior college, and have been on the job for less than 2 years. So we're not talking about seasoned veterans here. We're talking about people who are right at the beginning of their careers, facing all the incredible pressures of nursing for the first time. Okay, so you'd think the answer is simple, right? A nurse who feels good on the inside provides better care on the outside. Case closed. But the researchers had a hunch it wasn't that straightforward. They felt like something was missing, like a hidden link in the chain. And that brings us right to the heart of this entire study. Is that link direct? Does a nurse's inner well-being just automatically lead to better patient care? Or is there something else going on? Some kind of secret ingredient that's actually connecting the two? Let's think about it like a simple 3-step puzzle. We've got step 1, the nurse's inner health. And we know where we want to end up at step 3, better patient care. The big mystery, the thing the researchers were hunting for, was step 2. What's that hidden bridge that explains how you get from one to the other? So what was it? What was this missing link? Well, it turned out to be something we can all relate to, and something incredibly powerful: a sense of purpose. Now, it has a fancy technical name, perceived professional benefit. But let's just push the jargon aside for a minute. What this really boils down to is how a nurse feels about their job. It's that feeling of being valued, the sense that you're doing something that actually matters, and getting to see and feel that positive impact. So, what does that actually look like in the real world? Well, it's that feeling that you're growing as a person. It's getting that nod of respect from your family and friends. It's building those really powerful bonds with your patients. It's that sense of belonging you get from your team. It's all the good stuff, all those positive emotional rewards you get from doing the work. And this connects perfectly to a really cool idea in psychology called the broaden and build theory. The concept is actually pretty simple, but it's also profound. It says that positive emotions don't just feel good in the moment, they actually broaden our minds and help us build new skills. So, feeling good about your job. literally makes you better at it. How cool is that? Okay, let's get to the data because this is where all the puzzle pieces really snap into place. This is where we see how it all connects and the whole picture becomes crystal clear. So, when they crunched the numbers, the researchers found two different ways this works. First, there's a direct path. A nurse's inner health does have some direct effect on their skills, but that's not the real story. The real story is the second path, the indirect one, and the influence is so much stronger when it travels through that feeling of professional purpose. So, how much stronger are we talking? Well, this is the number that just blows the whole thing wide open. 67.1%. That's how much of the total impact comes from that feeling of purpose. Just let that sink in for a second. Over 2/3 of the connection between a nurse's well-being and their skill comes from feeling valued at work. This isn't some minor detail. It's the whole show. So to put it really simply, think of it this way. There are two routes for a nurse's inner health to improve their care. There's a small, direct, country road. But then there's this massive, multi-lane superhighway, and that highway is job satisfaction and a sense of purpose. And that's the route that carries most of the traffic. It makes the biggest difference by far. Okay, so what does this all mean for the real world? What's the big takeaway here? This gets us to the heart of how we can actually create better nurses. And at the end of the day, better care for every single one of us. Well, these findings basically hand hospital managers a clear roadmap. Yes, of course, you should support a nurse's personal well-being. That's a given. But the game-changing move, the most crucial thing you can do, it's to focus on boosting that sense of professional benefit. That means you have to actively build a culture where new nurses feel valued, where they see their purpose, and where they get recognized for the unbelievably hard work they do every day. This quote from the study itself really just says it all. It's a chain reaction, plain and simple. New nurses with better spiritual health were more likely to perceive more professional benefits, which were related to higher spiritual care competence. So, better inner health leads to feeling more purpose at work, which is what ultimately unlocks truly great, compassionate care. And that really leaves us with one final, powerful question to think about. I mean, we've been talking about nursing this whole time, but this idea feels so much bigger, doesn't it? If supporting a person's well-being and their sense of purpose can so dramatically change the quality of their work in a place like a hospital, just imagine where else that could be the secret ingredient. What other jobs, what other parts of our lives could be totally transformed if we focus less on what people do and more on why they do it?